Hello and welcome. This is Dr. Gerard Cuomo. I'm here with another rescue case. This time, Astra has called me on to rescue this case. There are 3 implant abutments. I'm going to walk you through this. Astra regulars. This is the old design of our abutments at the time. So this is the screw portion of the abutment. This is the abutment itself. So all the abutments are fractured right at this level. So it's our job is to remove the screws themselves. Now they're all part of this is the fixture and this is the actual screw itself. The size of the implant fixture is a very narrow size. This is it right here, Astra, regular, not the Evo or the Eva. So I'm going to show you this more closely. And the cool thing about this is no one's gotten in there prior to me. So there's only prior access, probably to look and check with an Explorer. So this came from the factory. This is the lab analog. You'll see the configuration. So nowhere are we going to be in and around the conical connection portion. We're just at the height of the screw. So if we had to classify this, classification would be that they are loose screw fragments, abutment screw fragments, that are located at the height of the first thread. The height of the first thread. This is the prosthesis. So she still has both ends. These are the distal ends are still supporting the 3 anteriors. So the dentist would like to retreat this case, and what they want me to do is to actually to alter the configuration, the conical connection of the 3 implants here in the anterior, the 3 that are fractured. These 2 are still in position. That's the order. I guess the redesign will come where they want to take another direction on this case. So next steps, let's go in and remove the screw fragments. Oh, okay. Too far back? All right, you're welcome. All right, so multi-unit abutments are found in a lot of companies. This one has 3 multi-unit abutments that were placed. Large cantilever coming off of a ceramic. It almost feels like a ceramic, but it's actually metal. And these are all denture teeth that are processed to this metal. So it's a nice design. Not sure how far back, maybe the dentist might put another implant back there, perhaps to prevent the anterior-posterior canting, or they might go with a bar type of thing and maybe a snap-on denture, something like that. We'll see. But I am following orders per dentist to go ahead and adjust the underside. They want me also to place these 3 healing abutments in there. If we have time, we'll do that. Those are the 3 healing abutments. And of course, once those go in, I do have to grind a lot underneath the bridge. So that's the goal. And now we can move forward. My dental assistant's now, she's going to give me the microsuction. And we're going there. We might not have to pick up, might have to remove these with the drill at all. We'll see. We did a lot of laser work already. Now it's time to get the screws out. So we're going to zoom in now. We'll start on the patient's left. And we'll be using a lot of indirect vision. So a lot of indirect vision. All right. Now we pre-soaked using our favorite, which is TNS solution. Pre-soaking is always good. It allows the screws to become more free. So as we're looking through now in this direction, this is the direction we want to go. In the mirror, it's right to left. How are we doing on the video? Little dark in there. Try to get this as crystal as I can get it for everyone to see. Alright, so there's our screw fragment. We're going to look even further. There she is. Alright, so you can see, I would think the company wants to see this fragment. So again, we're going in this direction and just spin it out. Still in the middle? Okay. Are we still in focus? Okay. Using a large mirror to bring more light in to our rescue here. Alright. So as it comes up, we just keep spinning it. Now we have a fork instrument that I'm going to use, so once I get it to a certain level, we'll use the fork instrument to take it the rest of the way. Alright, so this one's got nice and free. Let's try to use our fork instrument. I'll show you what that looks like. So here's the end. It's a reverse fork, and you can see very sharp ends to that. Now we'll just grab the top of the screw and bring it right on up. Hopefully we'll do it by hand. Okay, retract. Yep, everybody get comfortable. Okay, once we start, we don't want to stop. Okay, out please. Okay. So I'm just going to insert the driver. Alright, microsuction. If we're comfortable. Okay. Oh, it's coming up. This is one method. Keep track of the number of spins. Looks like it's almost out. And we'll need a little more retraction. Now we don't want to use any rotaries. Just kind of handle it. Okay, up it comes. I can see it's almost out now. And we're going to pre-soak it a little bit just to be on the safe side. Okay, I need that suctioned out. Sorry. Okay. All right. That okay? We'll change out that. All right, we're going to take a little break here. Just going to change out some gauze. All right, I might even rinse it a little bit. Just make sure you don't taste anything bad. I think we need a new tip on that. Now we're going to look for our other, well, we're changing out the gauze. I'm just going to get a few other instruments here that could work really well as well, and are really good with grabbing the top of the screw fraction. That was by Astra. This is another one from Astra, another one of their drivers. Alright, coming back. This one from Astra has little, like 4 teeth on the end of it. Let's see if we can get right in the middle. Have you bring your chin down a little bit. Yep, and I'm going to have you open up a little bit wider. Perfect. Alright, let's see if this is better. And now we'll use the suction tip. Looks like we're making good progress here. So let's see, a micro suction tip next. Not quite there yet, it's still coming up. So much room we have in there. Let's see if that's bringing it up. Yes, okay, let's go in with the suction tip now, micro suction tip. Okay. It's very mobile. Almost. So we got a little different one that I made. This is one of my own designs. And we will use one of those now. And it's just a simple little device. It's the same design. It's got 4. You okay? Pulling too hard? Okay. Okay, same design. Okay. You good? Alright, open wide. Let's see if we can slide in there. There we go. Now we can turn. Let's see, unless I'll double check. Okay. I want to make sure it fits fine in there. It looks like we're okay on the fit. Yeah, so that should work well. Alright, here we go. Open wide again. This is a tough spot. A little bit of a challenge, but we'll get it. Turn away from me. The other way. Okay. Yep. There it is. Microsuction. So now I'm going to take out the screw. Here it comes. And we need a little more power behind our suction tip. So we use the screen. We want to keep all our fragments, so we study them. The company needs to study them. Let's see if we can get that out. If not, we'll just simply... Okay, so something's still holding it in, so we need a pair of cotton pliers. So you can see the fragment sitting right there, but I think the soft tissue has its way. Let's see, no, we didn't want to push that down there. Suction tip again. Let's go with a larger suction tip on the micro suction. So instead of a yellow, you're going to get a different color. Let's see if it did come out. It might have got out, and we probably got it down in the trap. Let's see. Oh, still in there. So a little larger suction tip. They're right in with this. So you'll see them. I'll go with a fresh yellow while you're looking. Let me have a fresh yellow. You're looking. Okay, well, she's going to get me a larger tip. I'm going to use this. And there we have it. We got one out. I'll show you that. So, success on the first one. And so before anything else, we'll pre-soak and clean the thread. So this is the first thread. You'll see 1, 2, 3, 4, 5 threads to it. And we'll blow that up on the screen. That's the fracture, the fragment. Alright, so first one's out without any problem whatsoever. She's doing really well. Patient's actually being very calm and comfortable through the whole ordeal. It's great. So we're going to do that 2 more times, and then we have to place the abutment. So I'm going to show you how we're going to do this now. So I'm going to clean up the first implant. And now I'm pre-soaking with TNS, and I'm going to go in and suction that out first. There's a lot of little stuff in there that needs to be suctioned out first, so we'll do that before we move on. There we go. While we're getting that ready, I'm going to open up the healing abutments because the doctors want me to utilize the healing abutments. And we'll get a driver for that. And we'll get that driver out. It's Ankylosis driver, or the drivers from Astra, Astra. So let me get that out now. And we'll place the very first one. But we want to double check the referring doctor's threads too, making sure that they're pristine. Looks like we are fairly pristine on this one. So we're going to go right inside, clean out the threads, place the first abutment. Open wide. Okay, so microsuction's next. Okay. Okay. And now I'm going to go in one time with the TNS. Make sure the threads get nice and clean. And then we rinse that out after. I'm going to do it 1 or 2 more times, then we'll rinse it. When we rinse it, we're going to be using a different suction. And then finally back to the... That's nice. Good. There's not much coming out of there, so that's good news. Now we'll go in and suction that out. Hopefully I'm in the center here. You can watch how I'm doing this. Now I'm going to just rinse that out, and then we'll suction it out again. Okay, so you can see virtually no seepage in there whatsoever. It's really nice and clean. Okay. All right. And after I give this back to my dental assistant, she's just going to change out this tip again. Okay, so we're ready to put the first one in. Driver was pre-assembled. Let me just find what I did with that. There's a gazillion things on my tray right now. Most importantly, we're going to put the first healing abutment goes in. There we go. So again, open nice and wide. We'll drop the magnification down. And actually, I'm going to just apply this with my finger first to get it hand tightened and inserted properly. Hopefully they gave me the right ones. It seems like it's engaging. Yep. Open wide again. And just literally hand tightening. Alright. First one is in. One down, two to go, guys. All right, you get the idea. So, not bad. The other two are going to be as good. So again, I'll just show you a little bit more microsuction. We're going to go through this. I'll walk you through it one more time. I'll microsuction it out. And maybe we can even start to spin them with the suction itself. Sometimes that works. Yeah. Get them moving. Okay. Back in with the large mirror. And just you can retract with your finger now. That's good. Are you okay? All right. So again, we're going in this direction. You can see this one has a fracture, a little piece there. Am I in the middle? So I'm going to spin this one out. The patient's doing really well. And if the spinning stops, then we pre-soak some more. Yeah. So it's time to pre-soak some more. I have to lower the mag in order to do this. And I would just keep the moisture in there and see if I can turn it more. Sometimes I have to put a little bit of oil down in there to do it. So once I get it to come up above the first thread, we're good shape. That's the key. Looks like we're in good shape here. It's coming. And just coax it like that. That's good. You can see how I'm coaxing that nicely. All right. There it comes. Now once it gets above the threads, then I can safely go in with that fork instrument and get it. That going in there. Like right now, I think we're in good shape. We're way above. I mean, you could still do it this way. Continue. It's just going to take a long time. All right, now we're on time constraint right now. We got to get this done. There's a screw. All right, so you can see that the notch, and that's the topography. The notch is there. That tells you where this one sheared off, but it left the tail. So you got to be careful. Oh, we don't go backwards. All right, see, it wants to pop up now. So I think we're probably can suction this one out, but I'm going to use my 4-pronger, custom made. Come right on in like this. Just made from a lab burr. Just take a thin carborundum disc. There it is. I would just use our suction tip. Are you able to get a larger one? Okay, they didn't have any larger tips. Okay. Okay, we'll use the screen. Trying the screen, if not we'll use this. I think we'll use the yellow tip again. So it's floating in there, we got it. It's just now we got to suction it out. Yep, it is ready to come out, Jack. Here it comes. There's number 2. We'll look at that. And like I said, the only difference is the topography where the fracture was. See that? So you're counting threads, everything looks good, pristine. So that's number 2. And we're going to get the third one, but before we do that, we're going to clean this out again. So the TNS is really my lifesaver. I can't tell you more. I mean, I searched up and down on solutions to use, and this TNS solution is granuoso. It's really good. We'll probably end up using a few more brushes on the next one. I can see the color is gray, then you need to continue to clean it. So we're going to rinse that out now. And then we'll suction it out. And now we're ready to put in the next abutment. Okay, so the next one goes in. Okay, threading it down, and then light tightening by hand. Perfect. Now we'll do the last one. So again, we're going to just pre-suction that out first. Now of course, we're almost done with our appointment. We got the last one to get out. Third is a charm, right? Third was a charm. So we just do light retraction. You can see how that is now slightly above. So it's not as good as to see. Try to give you one more look here. There's some moisture in there. We'll leave the moisture in there. We'll suction that out. Okay. The last one. This saliva likes to go in this. Alright. Yeah, looks like we can almost spin this out just with the suction itself. Yep. And then out it comes, right? A rabbit out of the hat. Almost. It's there. Okay. Drowning. Pop that in. Sorry. Again, we're going to use the fork instrument. We'll do that now. It's a custom make because it's a better size than a lot of the companies make. It's a little better wider size. It fits over the screw better, and that's the key. Is if you do make your own instruments, make them on the bench. Do a bench chest. Now we're ready to get it out. I'm going to zoom in for everybody. You can see it's just sitting there now. That's usually how it looks like it's on its side, a little tired. So we're going to use the microsuction with the yellow tip. And yeah, you could see there was some abrasions. You can see a little bit on the... There we go. And there's number 3. There you go. We'll take a look at this one very closely. Alright, so third one is out. We'll put that in here. Back in the mouth. And now we have one more to place. So a little bit of TNS goes in. And then you just take a look. It looks very clean. We've cleaned this one nicely. We're going to do one more pass and then rinse it out thoroughly and then suck it out again. All right, here we go with the rinsing. And now suction that out. Okay, and now the abutment. Last one, guys. There we go. Final healing abutment. We'll start it by hand. Like the threads all look good. Alright, get that one in there like that. Tighten it a little bit first. Insert the driver. And just turn it gently. So you feel the threads connect. Once they connect, just keep tightening. Be a little pressure for our patient. That's good. They're all just hand tightened in now. Alright. So this is Dr. Gerard Cuomo. Another successful case. I've got to do a little job now of adjusting these 3 to make everything fit. But thanks for watching. If you got any issues, problems, just feel free to give me a call at 561-391-6290. Take care. Have a great day. Yes. Have the mouse. Thank you. All right.